Hi everyone, I'm Dr. Faisel Sayed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Today, we're talking to Corey Feist from the Dr. Lorna Breen Heroes Foundation and Joel Palau, ChenMed's Manager of Employee Health and Wellness, about mental health support for the Frontline. Let's dive right in.
Oh, look at that. Joel, it's good to see you. Corey, welcome.
Hey, nice to meet you, Dan.
Hey,
You're
Corey.
looking as handsome as ever.
Yeah, you can pile it on.
There's a cue card right behind you that says, "Say Dan looks as handsome as ever."
It's right next to the applause. You can see everybody.
It is.
Right.
Golf clap. Golf. Yeah. Great to see you.
Yeah, it's good. It's good seeing you, Corey. And
Thanks,
I'm sorry for the circumstances that lead you to being where you are, but it's great that there's some good coming out of that as well.
Thank you.
So
we're working on it, my friend. We're working on it. Thank you for saying that.
We're so happy to have you on, like Dr. Dan said. I mean, not under these circumstances. Our space is the outpatient primary care space. We also do a lot of public health work, a lot of urgent care, emergency room work, and our centers. They're stocked with medications but the model in which our doctors and the nurses practice is very different from your typical billing model. So we take on all the risks, so our doctors and our teams aren't concerned with billing. And so we see that many doctors feel much more fulfilled practicing in a model that's outside of the billing model. And we're actively focused, and we're trying to address burnout wherever possible, especially with everything that happened during the pandemic. So we're just so happy that you were able to take the time out to join us today.
It's my pleasure to be here. Thanks so much for having me.
So Corey, I'd like to get started off. We love to kind of just get to know our guest. So I'd like to know about I know a little bit from Dr. Dan. He's told me about how you two know each other, but if you can kind of let us know how you've gotten into healthcare and what drove you there.
Sure. So I started healthcare really deeply in the late 90s when I was in law school, and I actually had a chance to spend a year embedded at Hershey Medical Center. I went to Penn State's law school, and we had a great internship at Hershey Medical Center. And because of its affiliation with Penn State University and the medical school there, had a great opportunity to really get embedded. And that's where my love for being inside health systems and really focusing on the unique challenges within healthcare began. I went into private practice and worked for some medical groups and in Florida, and then really became drawn to the University of Virginia. And in 2001, started a 20-plus year career at the University of Virginia Health System, beginning first on the hospital side, working on legal and government relations work, and then moving over to the medical group side after about 5 years at the hospital. And that's where I spent the remaining almost 15-plus years, where I worked as first the general counsel, then the general counsel and chief of staff, and then the chief operating officer, and then the CEO. And in the middle of there, I went back and got an MBA because I was trying to figure out how I could use some of this problem solving that we have seen in other industries really apply to healthcare. And one of the things that I really became deeply passionate about was taking care of the worker so that they can take care of the patient. It's really that simple. And we spent a lot of time working with both an outpatient group and inpatient groups, just trying to really take administrative burden off the healthcare workforce so they can take care of patients. And that's my passion. And then, tragically, my professional and personal life completely collided in April of 2020 when my sister-in-law, Dr. Lorna Breen, who was the medical director of a very, very busy Manhattan emergency department, died from suicide after taking care of COVID patients on the front lines, contracting COVID herself, and then trying to go back too quickly and really running into a tsunami of death and dying that she'd never experienced in her seasoned career. And so that's where we find ourselves today, is really still about just over 2 years from that date. and trying to step into this arena and really make an immediate and long-term impact on the well-being of the healthcare workforce.
My goodness, when you speak about your professional and personal worlds just kind of colliding in that moment, what you said before about prioritizing the needs of the workers sounds like a lot of what we say in our world, where we say, what good are we to our patients if we don't take care of our doctors and our teams first?
And it's exactly that simple. And there are so many, and yet it's so complicated, obviously, but there are so many industries that have figured this out before healthcare. You can probably say that about a lot of different parts of healthcare, frankly, but in particular, this area is ripe for opportunity, I like to say. Another healthcare expert or a leadership expert recently said, or it's 20 years behind, depending on your perspective. But I like to view it as a glass half full opportunity to really step in here and realize there's a connection here between uh, the well-being of the healthcare professional and the quality of patient care. And there is data that shows that there's a 200% increase in medical errors when the workforce is burnt out. So that's quality right there. If you went into an outpatient setting and you had an instrument or some part of that outpatient exam that you knew was going to create a 200% increase in a medical error, you would never allow that in your exam room. And yet we allow physicians and nurses in those exam rooms every day who are burnt out or are burning out. And so there's a lot there that we can do and a lot of opportunity to make it better.
Yeah, But there's and I think you're working on this. There's a pretty big incentive for workers not to come forward and for people not to talk about it. I saw the statistic in the New York Times, I think it was this week, that said there were 19,000 handgun deaths in the U.S. or handgun homicide in the US this last year, or firearm homicide in the US last year, but there were 24,000 suicides by firearm in the US last year. And I know Faisel and I were talking about this, and we know of at least one case where a faculty member at an organization is traveling an hour and a half to get mental health care under an assumed name and paying cash, so there's no medical record to go with that. And so how do we get I mean, obviously, and I mean, we've talked to other people who knew Lorna, and she's obviously a fabulous doctor. And you got to think that, and I know she even wrote on burnout, right? And so she published on burnout. So if she couldn't help herself, how do we make it so that it's okay to ask for help?
Well, so I know we have 6 more hours left for this podcast, so let me just go through each one of those layers. So a couple things you just hit on, Dan, that are really important. First of all, and the most important, is the culture. We have to create a culture of support for ourselves and each other, and recognize that in order to bring your best and for your colleague to be able to bring their best, this needs to be a safe place where people can raise their hand and say, I'm not feeling well, or, hey, you don't look well, and I need to intervene. And I will tell you, I have heard so many stories in the past year about interventions, more interventions than prior to our story, that give me hope, where a nurse will see another nurse and tap that nurse on the shoulder and say, hold on a minute, you don't look good. Or a doctor will see a doctor, or some mix of those two. But creating an environment where it's okay to seek help and to intervene with others is, I think, a crucial step, because no matter all of these barriers that exist, and there are many, and I'll get to those in the 5th hour of our talk this afternoon, we have to have a culture that embraces this work. And I'll give you one quick example. So there's a program called Stress First Aid. It was adopted by the military. It's used by the Schwartz Center for Compassionate Care, has really started to scale it. And at the University of Virginia, we created a model using that before I left and retired. And then in another Northeastern school just gave me this great example where there was a doctor who showed up for morning huddle and put her dot on red. And it's a stress continuum. And she was in a safe enough place where when she put it on red, first of all, she felt like she could tell others that she was on red, but her colleagues intervened. And she said, well, I didn't want to tell anybody, but I have all these things going on. And she wasn't suicidal, but she was on the brink. But I didn't want to let down my colleagues. I didn't want to let down my patients.